Hello friends, nice to see you again. Let's enjoy Dr. Y's chest radiology. I'm Dr. Y, medical professor, chest radiologist, Seoul, Korea. Today we're going to talk about asbestos-related pleural plaque X-ray and CAT scan findings. Chapter 61, let's go. Asbestos-related diseases are disorders of the lung and pleura caused by inhalation of asbestos fibers. Asbestos-related diseases include non-malignant disorders such as 1. Asbestosis, a kind of pulmonary fibrosis. 2. Diffuse pleural thickening. 3. Today's topic, pleural plaque. Asbestos-related pleural plaque. 4. Pleural effusion. 5. Rounded atelectasis. 6. Malignancies such as lung cancer and mesothelioma. Asbestos risk. People who worked in jobs with high asbestos dust exposure are at the highest risk of developing asbestos-related disease. However, exposure to asbestos may also occur in the worker's home due to dust that has accumulated on the worker's clothes. Non-malignant asbestos-related pleural diseases. A. Pleural plaque. B. Diffuse pleural thickening. 3. Asbestos pleural effusion. 4. Rounded atelectasis. The pleura appears to be more sensitive than the lung parenchyma to the effects of asbestos fibers. Thus, pleural diseases can result from much lower doses than the fibrotic changes in the lung, the asbestosis. Asbestos-related pleural plaques are the most common manifestations of asbestos exposure, affecting up to 58% of asbestos-exposed workers. Pleural plaques are discrete, circumscribed areas of hyaline fibrosis of the parietal pleura and rarely visceral pleura that develop 20 to 40 years after first exposure. Over time, usually more than 30 years, they often become partly calcified. They consist of mature collagen fibers arranged in an open basket weave pattern and are covered by flattened or cuboidal mesothelial cells. Pathology. They have a white or a pale yellow, shaggy appearance and are typically distributed on the posterior lateral chest wall, diaphragm, and mediastinal pleura. The numbers and sizes vary. The pathogenesis of pleural plaques remain still uncertain. The most likely explanation is that asbestos fibers reach the parietal pleura by passage through lymphatic channels or somehow directly through the pleura, and they excite an inflammatory reaction. Implication of a pleural plaque. Pleural plaques are evidence of past asbestos exposure and indicate an increased risk for the future development of other asbestos-related diseases. Pleural plaques in themselves are usually considered not as pre-malignant. Radiographic features of pleural plaques. Pleural plaques typically arise from the parietal pleura, most frequently from the lower portion of the chest, sparing the apex and costophrenic angle. They are also frequently found arising from the mediastinal pleura. Visceral pleura may also be involved infrequently. When such visceral plaques are present, they are typically associated with underlying parenchymal abnormalities, asbestosis, and extensive pleural disease. The plaques may be calcified. Chest X-ray findings. 2. Pleural plaques exhibit so-called incomplete border sign. The medial margin is often well defined because it is tangential to the X-ray beam, and the adjacent lung is a good contrast media. The tapering outer margin is indistinct as it is unfacet to the X-ray beam, and the chest wall provides less tissue contrast. Calcified plaques are more obvious than non-calcified ones on chest X-ray. Locations most commonly encountered include posterolateral, mediastinal, and diaphragmatic pleural. The appearance is similar to holly leaves. Madam, you quit smoking? Wow, your best job of this year. Congratulations. Let's have a short break, enjoying the copper engraving, showing us another leaves, not holly leaf, but fig leaves of Adam and Eve by Albrecht Dürer, German Renaissance painter, 1504, copper engraving, 30 centimeter, Morgan Library and Museum in New York, according to Wikipedia. They are Adam and Eve. In their hand there is an apple, and there is another creature, bad creature, snake, serpent, on the branch of the tree. Because they ate the apple and they realized how shameful, because they are naked, so they realized and to be draped, to cover their body, important body, with leaves. They are fig leaves. How about this film? The classifications of the parietal pleural are similar to the previous film slide of holly leaves. Old man, more extensive pleural plaques and denser pleural plaques density. On the axial bone window setting CT, we see the multiple pleural plaques bilateral, anterior and posterior, even mediastinal pleural with parietal pleural dominancy, not visceral pleural dominance in the yellow circle. A little younger man with many pleural calcified plaques here, and with even diaphragmatic pleural calcified diaphragmatic pleural plaques. On axial CT, bone window setting, upper portion, more upper anterolateral portion of pleural plaque with calcification, but more lower portion we see posterior medial location of the pleural plaque with calcification. This is more characteristic of a pleural plaque location. 60-year-old man shows only tuberculous scar-like density on his left upper lobe. Other areas are looking good. And on his axial CT bone window setting, we see calcified pleural plaque on right upper anterior, left upper anterior. This surely is the density on chest X-ray. And we see also the posterior medial portion of non-calcified pleural plaques here and here on the left side. Another patient with non-calcified pleural plaques. On your left side film, upper lung zone, the pleural plaques are more on anterior and lateral location. And on your right side, lower lung zone, the plaques are more likely to be on posterior medial location. That's somewhat characteristic. Same patient of coronal reformatted image of non-calcified, both diaphragmatic, pleural, non-calcified plaques. This location, diaphragmatic pleural, is more specific. Even some doctors say pathognomonic of asbestos-related pleural plaque. This is the last film, last image, last painting of this tour. On your left side chest X-ray, we are now sure that this is the film of asbestos-related pleural plaque because we see bilateral pleural calcified plaque of hollow lip appearance and both diaphragmatic calcified pleural plaques. They are more specific, even pathognomonic. On your right side with the CT axial image, we see the diaphragmatic pleural calcified plaques. Now we finished to understand the findings of asbestos-related pleural plaques. Congratulations! You subscribed and liked. Thank you very much. Be healthy and be happy. See you soon. Bye-bye.